Hello, students. I am Mrs. Geraldine Garisha Amar, your subject teacher in MAPE. Before anything else, I would like to start our class with a short prayer. Our learning competencies for today's lessons are: discuss the stages of infection, analyze the leading causes of morbidity and mortality in the Philippines, explain the different elements of the chain of infection. I hope you will enjoy our lesson for today. In our previous lesson, we discussed about responsible parenthood. Now, I will give you 5 seconds to explain why it is important to manage responsible parenthood to their children and what is the importance of family planning nowadays. Your 5 seconds starts now. To answer the question why it is important to manage responsible parenthood to their children, it is important to manage responsible parenthood to their children in the family because responsible parenting is necessary to teach children the right behavior, culture the healthy habits and morals, and also guide in right direction throughout. And to answer the question, what is the importance of family planning nowadays? The importance of family planning nowadays is very significant. Planning for a child will help you avoid the social, health, and financial problems you face if an unplanned pregnancy happens. I hope you did it right. This lesson is designed as an introduction to what we mean about infections, stages, and the leading causes of morbidity and mortality in the Philippines. Let us check what you have already known about this new lesson. Write T if the statement is true and F if the statement is false. Write your answer on your activity notebook. For today's lesson, we are going to discuss about infection. What is infection? Infection, an invasion of microorganisms into the body that are capable of producing a disease. This is the invasion of an organism's body tissues by disease-causing agents, their multiplication, and the reaction of host tissues to the infectious agents and the toxins they produce. Contact or mode of transmission is a common form of transmitting diseases and virus. There are two types of contact or mode of transmission. We have the direct and the indirect. Direct contact transmission occurs when there is a physical contact between an infected person and a susceptible person. Indirect contact transmission occurs when there is no direct human to human contact. Contact occurs from reservoir to contaminated surfaces or objects or to vectors such as mosquitoes, flies, mites, fleas, ticks, rodents, or dogs. Chain of infection. More specifically, transmission occurs when the agent leaves its reservoir or host through a portal of exit, is conveyed by some mode of transmission, and enters through an appropriate portal of entry to infect a susceptible host. There are six links in the chain of infection. We have pathogen, reservoir, portal of exit, mode of transmission, portal of entry, and the susceptible host. These pathogens are the infectious agents. Example: bacteria, fungi, virus, and etc. Reservoir. It is a place within which microorganisms can thrive and produce. Reservoir is a source of infection like people, water, animals, environment, and etc. Next, portal of exit. It provides a way for a microorganisms to leave the reservoir. Mode of transmission. It is the method by which the organisms moves from one host to another. Portal of entry. It is an opening allowing the microorganisms to enter the host. The susceptible host. It is a person who cannot resist a microorganisms invading its body. The susceptible hosts are babies, children, elderly, people with weakened immune system, unimmunized people, anyone. There are four stages of infection. We have incubation stage, number 2, prodromal stage, number 3, illness or clinical stage, number 4, recovery stage. Incubation stage. It is when a person acquires the pathogen until the appearance of the first sign or the silent stage. Prodromal stage. It is when there are non-specific signs and symptoms appearing, like headache, runny nose, and slight fever. Illness or clinical stage. It is a time when illness reaches its highest point of development, wherein the patient is experiencing severe ache, vomiting, high fever, sore throat, sinus congestion. Recovery stage. This is the time when recovery seems complete, although the disease is still communicable. Pathogen has mostly eliminated. Morbidity and mortality. While they may sound similar, morbidity and mortality are two different things. Here is why. Morbidity is any physical or psychological state considered to be outside the realm of normal well-being. Is often used to be describe illness, impairment, or degradation of health, especially when discussing chronic and age-related diseases which can worsen over time. While mortality is the state or condition of being subject to death, mortal character, nature, or existence, the relative frequency of death in a specific population death rate, mortal beings collectively humanity. Here are the leading causes of morbidity in the Philippines. Number one is acute respiratory infection. Acute respiratory infection is an infection that may interfere with normal breathing. It can affect just your upper respiratory system, which starts at your sinuses and ends at your vocal cords, or just your lower respiratory system, which starts at your vocal cords and ends at your lungs. This infection is particularly dangerous for children, older adults, and people with immune system disorders. Number two, pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. Number three, bronchitis. Bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus, which can be discolored. Bronchitis may be either acute or chronic. Hypertension. High blood pressure or hypertension is a common condition in which the long term force of blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Number 5. Acute watery diarrhea. Diarrhea or loose, watery, and possibly more frequent bowel movements is a common problem. If you have a diarrhea for weeks or longer, you may have a condition such as irritable bowel disorder or more serious disorder, such as persistent infection or inflammatory bowel disease. Number 6. Influenza. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it is not the same as stomach flu, viruses that cause diarrhea and vomiting. For most people, the flu resolves on its own, but sometimes influenza and its complications can be deadly. Number 7, urinary tract infection or UTI is an infection in any part of your urinary system, your kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, the bladder, and the urethra. Tuberculosis or TB is a potentially serious infectious disease that mainly affects your lungs. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air via coughs and sneezes. Number 9, injuries. Any damage to your body is an injury. Injuries can be caused by accidents or acts of violence and may occur at home, work, or play. Common types of injury include abrasions, lacerations, hematomas, broken bones, joint dislocations, sprains, strains, and burns. Lastly, the acute febrile illness. Acute febrile illness is the medical term used to describe a sudden fever or elevation in body temperature. This happens when the body is invaded by a pathogen and the immune system is activated to fight it off. And now, let us proceed to the leading causes of mortality in the Philippines. We have number 1, disease of the heart. Heart disease describes a range of conditions that affect your heart. Heart diseases include blood vessels disease, such as coronary artery disease, heart rhythm problems, heart defects you are born with, heart valve disease, disease of the heart muscle, heart infection, and many forms of heart disease can be prevented or treated with healthy lifestyle choices. Number two cause of mortality in the Philippines is disease of the vascular system. Vascular disease is any abnormal condition of the blood vessels, the arteries, and the veins. The body uses blood vessels to circulate blood through itself. Problems along this vast network can cause severe disability and death. Number 3. Malignant neoplasm. The term malignant neoplasm means that a tumor is cancerous. A doctor may suspect this diagnosis based on observation, such as during a colonoscopy, but usually a biopsy of the lesion or mass is needed to tell for sure whether it is malignant or benign or not cancerous. Number 4. Accidents. An accident is an unplanned event that sometimes has inconvenient or undesirable consequences, other times being inconsequential. The occurrence of such event may or may not have unrecognized or unaddressed risk contributing to its cause. Number 5. Chronic lower respiratory system. This comprises three major diseases. These are chronic bronchitis, emphysema, and asthma that are all characterized by shortness of breath caused by airway obstruction. Number 6. Diabetes mellitus. It refers to a group of diseases that affect how your body uses blood sugar or glucose. This glucose is vital to your health because it is an important source of energy for the cells that make up your muscles and tissues. It is also your brain's main source of fuel. Number 7, nephritis. It is an inflammation of the kidneys. It has a range of causes and can be acute or chronic. Early symptoms may include changes in the color of the urine and swelling of hands and feet. Lastly, certain conditions originating in the prenatal period. Conditions which originate in the prenatal period. For example, the period immediately before, during, and after birth. Number 2. I have to decide. Read the column when this happens. Analyze if you will do or not the statement in the column. What will I do? Put a check mark on the column that corresponds to your answer. Put it on your answer sheet. For the next activity, copy the figure below in your activity sheet and put the different chain of infections in the box based on the story below. Remember that the elements in the chain are sequentially arranged. Get clues from the guide questions below.